And before I begin, just a quick note. If your doctor is saying that the only way to get rid of the puffiness is by having a surgery,
how do you remove eye bags? Well, number one, surgery.
Then I advise you to change the doctor as soon as possible. Hello, my dear friends. Welcome back to my channel. This is Anna's Face Shaping Studio. Today I'm going to get a little bit of theory and I would like to answer some of your questions. Probably some of you are doing my massages and you're wondering why are we doing this, why we're not touching the eyes, why we're not touching the mouth. So today I would like to open up some theory, how everything is interconnected in our body and how, for example, the nasolabial folds could be a problem of your back of the neck and posture. Today's topic is going to be puffiness around the eyes, and even we will be talking about the hernia. I know that many people are bothered with this topic. There are a lot of reasons of why we are having puffiness around the eyes, and we can fight with them without doing any surgeries. Puffiness around the eyes is usually explained by the diseases of the cardiovascular and endocrine systems, and many doctors are even saying, well, you are already at the age, or this is because of the hormones, or look at your kidneys are having the problem. All of this actually can take place, it's true. But if you think that there are no obvious problems in your body and you are like in your 30s or 40s or even 50s and you're an absolutely healthy person but you still have puffiness, then probably the problem is not exactly there. And if you think that, oh, my mother or my father had the puffiness in their eyes,
I used to be really insecure about my under eye bags. It's genetic.
So you are absolutely wrong. Even genetic is not the problem of why you are having puffiness around your eyes. Today I'm going to explain you 3 reasons of why you probably are having puffiness. Please pay attention to this amazing picture. What can you see here? This is the subcutaneous fat on our face, and as you can see around the eyes, there is almost no fat. So if we had fat over here, if there was like the compartments for fat, they would absorb the water. And as a result, the puffiness would be going away, but we don't have. And because of this, all the puffiness is usually concentrated around our eyes. Why this is happening? Reason number 1, posture and hunching back. This is such a small thing, such a small reason, but it actually is true. So our blood is moving from the top of the head down towards the heart and is moving the blood all around. And when the blood vessels are opened and they are not stuck, the diameter is normal. Our endocrine system is working normal, and as a result, you have an open eye. But usually when we are sitting this way, hunching ourselves, when we're watching the phone, when we're sitting and texting, when we are putting our shoulders closed like this in the chest, all of this leads to hypertonus of the neck muscle. As a result, the liquids are going to the areas of low pressure, which is around our eyes, in the orbital area, because it just has no other way to go and is stuck here. There is like a stagnated swamp of unnecessary liquids, stagnated lymph, bad blood, closed blood vessels. All of this is here around our eyes. All of this is so simple and makes so much sense, but for plastic surgeons, of course it doesn't, because you're not going to pay the money to do the surgery. And even if you do it, after some period of time, if you continue to keep your posture like this, if the blood flow is not going to be regulated, you will get back to the same puffiness. So it's just a closed circle. And what are you going to do? You're going to go to the surgeon again, and he will tell you, well, this is your genetic, this is your kidney problem, this is cardiovascular disease problem, or something else and something else. Not that there is a wrong posture which you are saving during the whole of your life. Reason number 2 is our aponeurosis. When we are getting older, with time our aponeurosis is getting stuck to its scalp, tendons get stiff, liquid is not moving normally, and as a result, what is happening? puffiness of our eyelids and around the eyes. So just imagine the aponeurosis is not moving and the vein vessels are also unable to move the blood. The liquid is moving through the soft tissues without the subcutaneous fat, as we have realized previously, and it is getting its final position around our eyes. Additional benefit if your aponeurosis is not moving is that you can have pain in this area, behind, in the occipitals. Most of the time you're experiencing some headaches over here around your eyes, over here, because this is the lower attachment of the frontal muscles which are moving all around our head, and as a result this area is getting stuck. We start receiving here large amount of wrinkles and get even more puffiness around our eyes. Why? Because of the skull is strictly and closely attached to the aponeurosis. Number 3 is muscle traps. The thing is that there are a lot of muscles around our eye. The orbicularis muscle consists of 3 types of muscles, plus under the orbicularis oculi muscle we have the attachment of the cheekbone muscle, of the zygomaticus, of the muscles which is lifting the upper lip, temporalis muscle over here, the frontal muscle, corrugator, procerus, all of them are connected to our orbicularis, and these connections are called muscle traps because connection of the muscles are much harder than the muscle itself. The muscle needs to stretch, the muscle needs to contract, so these areas are like an obstacle for the liquid to move freely. If these muscles are over tensed, over contracted, if there is no normal fluid, you will be having not only puffiness around your eyes, you will be having the dark circles, and the ligament, the tear-through ligament, will be more and more obvious on your face. Most of the cosmetologists, I think it is even one of the most famous cosmetological procedures to put fillers inside the tear-through ligament. The problem is not the age. The problem is that there is no normal blood flow and liquid flow. If we are not working properly with the surrounding muscles, then all the puffiness will be concentrated around our eyes. The same with hernia. Hernia is like a fat compartment under our eyes, and they're saying that this is the reason of aging or loss of skin elasticity. It's not exactly so, unless you're probably like 70, 80 and you're having hernias. Most probably yes, this is aging and loss of elasticity. If it is before, if you're 30, in your 40s, then this is a normal movement of the liquids in your face. Tensed muscles, wrong posture, the aponeurosis stuck to scalp, blood flow which is in obstacles. All of this is the reason of your hernias, and you need to work with it. You are not supposed to do the surgery right away as soon as, oh, I see it, just get rid of it, because it will come back. The hernias are coming back because you're just working with the symptom. The symptom is like the final step, with the visible one. You're not working with the problem inside. The cause, the true cause of this hernia, why it appeared. So what is the message I'm trying to give you today? If you are advised to do the surgery at the moment or put fillers to get rid of your tear-through ligament, or just to put some mesotherapy and even increase the amount of liquid in the area of your eye which doesn't have continuous fat, again, I insist. So all these methods are fast solutions which are not going to give you long-term result. And before going under the knife, please try to get some more information, try alternative methods, and only after that, only after you've already tried everything, you've been working with a face expert, you've been working with osteopaths, you've been working with doctors who are trying to see the cause of the reason, not just get the money from you. Only after that you are free to do some strong surgical operational procedures. So I hope that today's video was useful, and I hope that now you will not be asking me why are we doing those aponeurosis massage, why are we doing those posture massages before we getting to the actual face. All of this is necessary to open up, to release the stagnation, to make the liquids flow, and the final step is just to work with the face. So be conscious, think twice. If you have any questions, please let me know, and of course don't forget to subscribe to my channel. I hope that today's lecture was useful for you, and until the next time, bye bye.